this patient, the more the pain, the lesser the burn, right? I think the nurses here can back me up. The more the pain, the lesser the burn. Why? Because when you have a first degree burn, you just have the first degree, so the skin where it is more sensory, so you're going to feel it more. As the burn goes deeper into the dermis and beyond the sensory level of the skin, you get a deeper burn, but you don't feel the pain more because all the sensory part has been burnt off. So if you are going to categorize your level of burn based on how you feel, then a third degree burn, you will think that that is not a problem, but that is the worst form. So I want us to have this at the back of our mind as we go further into dealing with the issues of back pain, that your level of pain does not always correlate with the level of problem or the level of pathology you have. You can have increased pain, but your pathology is what? It's less. And then you can have worse pathology, but your pain is even what? Little. And as a clinician, I've seen it so many times where people come and their spine is even crushed. MRI shows multi-level degenerations and all, and you think that this person should not. But if you come to places where I come from, like in Ghana and everything, you see the kaya, the things they carry on their neck. You do an MRI on their neck, you will say this person should not be able to turn even their neck because the load on their head. But they wake up every single day and go to the market, and you ask yourself, why? So that is the first thing I want you to remember. Pain does not correlate with the level of what? Pathology you have. I think I've laid the first principle down. Because if not, then what you're going to think is that when I take the paracetamol, the acetaminophen, the opioid, the oxycodone, the meloxicam, all those things, it means that as soon as the pain comes, it means that, oh, my problem is gone. No. That is the mistake we all make. So let me define. So if that is the case, what is pain?
Okay.
In a well-researched paper by Mosley,
Okay.
being enhanced by Adrian Lowe happened to be one of my mentors, my professor.
Yeah.
He says this: pain is a multiple system output. And I want us to understand this. Pain is a multiple system output activated by an individual's specific pain neural signature.
Wait.
The neural signature is activated whenever the brain concludes that the body tissue are in danger and action is required. Let me explain this. I know I have some of my mothers on this platform. Joe, if you can mute your iPod for us. This is it. What it's trying to say is that whenever you have pain, it's not a simple thing. If you look at this diagram, pain is a multi-system output. So the pain you experience is an output, it's not an input. And it is coming because both your tissues and your environment is sending information through your spinal cord right into the processing centers in your brain, and an output or a result, which is the pain symptoms, come out both to your tissue, and then you change your environment in reaction to that output. So one of the things you're going to notice is that, let's say the pain is just like you are sitting here, like I'm sitting here in this office. I have a computer, or you have a TV, you're watching in your TV room, and then a lion comes in. One of the things you're going to notice is that when a lion should come in this building right now, it's going to affect all of this. Your heart rate, your relationship, how you sleep, and everything will be affected. So I want you to have that as a back of your mind, that whenever you are having a pain symptom, it's just a multi-system issue that is actually coming out. The pain is just one of them, just to tell you that there's something wrong and you need to take action.
I think
the host can mute the person, please.
So, host, can you mute Joe's iPod, please?
There's still glad they don't take it. It's a phone, baby.
Yay!
Okay. Thank you. So, like I was saying, back pain. So let's narrow it down to back pain. So since back pain is one of them, whenever you have back pain, you should have it at the back of your mind that sometimes it is not just only the back. There are a whole lot of things that is happening around you. So I want us to think about it this way. How do I change the issue with back pain? And I want you to understand that it's a very lofty goal. It's a very huge issue. But this is one of the mindset that I need for you to actually change. We've laid the first principle. I want us to go to the second principle. The second principle is that pain or back pain, I just want you to look at it like you are trying to climb a mountain. The aim is for you to climb the mountain and be on top of that mountain. That is the goal. That is where you want to get. At the end of it, you just want to, so if I should use this phone, you have this phone, you want to move from this base and climb all the way to the top here. Now, for you to do that, there are steps that you need to take for you to get all the way to the summit. But a lot of time, the reason why most people are not successful when it comes to back pain management is that you want, just like I gave the first principle, we think that as soon as we do one thing, the pain should change. So as soon as we decided that, hey, we want to come to the top here, just by one action, we should move from here and come to the top of the summit. So just as you are climbing a mountain and it takes some time, like anything you do in life, you build on it to be able to get to the top. I always want people to have that at the back of their mind and the management of back issues. That you need to take concerted effort, one piece over the other, to be able to overcome the entire issue of back pain. And I want you to take from me, anybody, any clinician who tells you that they have one-stop shop solution in dealing with back pain is a liar. There's no one solution in solving back problem. It can be medications, it can be surgery, it can be, and I'll give the reason why as we go along. So for most people, you need to start thinking about the little things that you need to do on a daily basis that are in good service of that goal. So your goal is to be able to be pain-free for your back, or you want to reduce the intensity of your back. But the spoiler alert is that some of the things that you need to do to be able to get to the top of that summit, to be able to be pain-free or to be able to reduce the pain, it has to be daily tasks, basis, certain decisions that you need to take daily for you to get there. Some of them have to be repetitive, some of them might be boring. The same way your job, and I want us to use our jobs. You know that you cannot just go to work one day and then you have all the money saved for your retirement. Then most of us would have been retired by now. But you and I know that for over 40 years of your life, depending, you need to work daily and be saving consistently. What is the goal? You are working safely and saving, maybe to buy a house, to buy a car, to have a good retirement. But you know that for you to get to that end, you need to make daily painful steps. Sometimes some of them are repetitive. You are doing the same nursing job, the same physical therapy job, the same occupation, the same banking job, accounting job. You're doing it repeatedly, waking up every morning and doing that over and over and over again till you get to the goal. It's the same approach you need to have a back pain. And sometimes, like I said, we need to have a change, and some of the change that we're going to have will involve, just like climbing, you need to have the physical, mental, nutritional, and social support to help deal with the issue of back pain. And most people need to understand that. Without that, you will never be successful in dealing with the issue of back pain. So it is the process of repeating the simple health related behaviors, which you're going to discuss over and over again without any expectations of quick changes. The reason why a lot of people with back issues fail is that they want microwave results, quick action. They think it's just like a headache where you put in Tylenol, acetaminophen, and all of a sudden probably it goes off. Back issues don't work like that. Sometimes people even think that let me go do surgery and after the surgery it's going to be gone. For most people who have had back surgeries, they will tell you even after the back surgery, the problem does not completely go away. And I know there are a lot of people on this platform that will back me up. So keep following me and let me tell you what it means. But before we know that, I just want us to take this moment. As we dive into what I mean by what I just said, I want you to watch this video. And it's a video I like so much. Some few seconds by the Canadian government actually showing us the importance of exercise and having a routine as part of our lifestyle.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Grow old with vitality? Or get old with disease? It's time to decide.
Yep. So it's time for us to decide which part we want to go in, specifically in dealing with the back pain. What steps are we ready to take? So one, I want us to deal, before we can go on, I want us to deal with certain beliefs about back pain that we need to stop. One, like I mentioned earlier on, most people think that chronic pain or chronic back pain means that something is wrong structurally. No. Chronic pain is not always due to serious damage. It is more of sensitivity, not structural. And as we go along, maybe when the questions come, I'll have other slides just to explain that. The reason is that we have 45 miles of nerves spread across our body. And these nerves, what they do is that they gather intelligence. And nerves are very sensitive that they need three things. They need mobility, they need space, they need blood supply. So I want you to think, if you are a parent here, I want you to think about back issues and the nerve as you having a child at home. You cannot just feed your child today and think that tomorrow they will not get hungry. Meaning you need to work to provide for them every single day. And the same way, that is how back pain happens. The pain that keep on coming is because either the nerve is being irritated and it's become more sensitive because of what happened yesterday. You starved that child yesterday, and because of that today, they see you and all of a sudden they start to panic because of what happened previously. Your body always keeps a score. Let's go to the next one. So a lot of time when somebody have the initial pain because they think that is what is a structural problem, mostly they come to the hospital and then what they want, sometimes they even want a full body scan. But I can tell you, the MRIs and the CT scans, the X-rays, they are just like the menu at a restaurant. They tell you how it looks, what it costs, the ingredients, But there has never been a time where a menu will tell you the taste of the food. So any clinician who base a patient's clinical decision based on what they see alone on an MRI always make a mistake. Because most times, like I mentioned earlier on, pain is a multi-system approach to dealing with a problem. So if you only cut the cord thinking that I will solve the problem, no. Pain is just a messenger. And if you should shut the mouth of that messenger, it doesn't mean that the problem has been solved. The question you should ask yourself is that what is causing the sensitivity that I'm experiencing? So somebody asks, is my body lying to me? Let me give a further example. You feel stiff and tight. You wake up in the morning, you feel stiff and tight at the back. At some point, you also feel loose and unstable. Sometimes you even feel misaligned or out of place. The question is your body playing tricks on you? In a study done in 2017 and done by Nelson too in 2020, it said that feeling stiff in your back, neck, or shoulder does not correlate with how stiff your neck or back or shoulder is. So the feeling you are having might not correlate with what is structurally happening. So I might feel stiff at my back, I might feel stiff at my neck, but it doesn't mean that when I should touch my neck, at this point, I don't have any pain in my neck. But if anybody should touch my neck, you know that my neck is stiff. So a lot of times, most people have just correlated most of their problems with this. The stiffness and stability sensations you are having are also similar to our beliefs, expectations, and past experiences. They can all play a part in how you feel because the body keeps a score. So meaning your muscles, the joints can feel stiff, loose, or stable, or even out of place because we are stressed, we are worried, and we are more concerned, and we have so many concerns, so many issues going on in our body system. That is why we feel stiff. We feel out of place. It doesn't necessarily mean that sometimes the structure is out of whack. And I'll tell you, there'll be one of the things you should notice is that medicine is business. You can have my colleague therapists, doctors telling you, oh, I had a patient. Let me give you this example. And I'm not here to slice any profession. Just a disclaimer. He came in and told me that, oh, Dr. Ben, I've been told that per my MRI, my spine is out of alignment about 4 millimeters. And they said the person was a chiro. And it was like, okay, so we need to do manipulation. I do manipulations. So he said, I'm going to manipulate and I'm like, okay. So when they did the manipulation, how did you feel? He said, oh, I felt good. I'm like, okay, good. But did he do any MRI just to show that when he did the manipulation, it shifted your man alignment from the 4 millimeters off back to 0, where it's supposed to be? Or can you ask him to do another MRI just to see after the intervention what he did and how the structure looks like, whether there's been any change? The answer was that there was no change. Meaning the manipulation that was done, that ease of the tension or whatever it is, was just a symptomatic relief. It didn't deal with the actual problem that is causing him to be stiff. Let's go on. So not because this thing is actually out of place, but it's also because, one, your entire nervous system acts like a smoke alarm. And sometimes smoke detectors are supposed to detect smoke. But if you have an overly sensitive system, even when you have steam water just around it, the alarm goes off. It doesn't mean that the whole house is on fire. For most of us, the reason why our back issue keep on getting worse is that we have overemphasized, and then in our brain, we've blown the thing to the point whereby it feels that the whole house is on fire, when actually it's just the steam that is blowing over the fire alarm. So the best solution in this situation is to try to decrease the sensitivity. And to decrease the sensitivity, unlike the smoke alarm where you can just go in and buy a new one, our body system is such that you cannot just replace the entire body and bring a new one. It means that we need to do a system reset. Some gentle movements, some relaxation, looking at a very holistic approach. What are some of the things that is causing the pain to increase? Let me give you another example. I had a 38-year-old young man, IT guy, come to the clinic. He's been prescribed baclofen, a muscle relaxant, because he's been having this chronic back pain all the way from the CT junction, like the neck here, all the way to the lower back. And he told me that it wasn't there, but in recent time, all he sits, especially in the morning, then the pain start getting worse. So they gave him baclofen to relax, and then some opioid to decrease the pain. So knowing what I know, I decided that we need to find out more. So I'm like, what time do you normally say you have the pain? He says it's in the morning. And I was like, can you be a little bit specific? Since you're able to tell that it's in the morning. It was like, oh, and early morning, mostly when I start work. So I asked him, what has changed the past, let's say, 12 months? Anything significant that have changed? He was like, not really. I just changed jobs. And then I also had this new boss. But I know that she's in the UK. We are here and we have to get up early because of the time difference. And she's a former military and she had this strict policy. And anytime I see her, I get nervous. And after that, I realized that I start having the pain. I'm like, okay. So after we started on peeling, he realized that all his pains start coming around that time. Anytime they are on the Zoom call with the boss, and then the tension, the muscle tension start coming, he start having more pain, the back start tightening up. So we said that, okay, then let's start to find ways to deal with that. Long story short, the young man decided to change jobs. Do you know that just that day, just by unpeeling, his pain, which was at 8, moved to 2 without any medication? At the same time, this same young man had MRI that was showing degenerative changes in the spine. And those degenerative changes were being blamed for the pain he was experiencing. But in actual fact, what was making him overly sensitive and setting his alarm off was not that. It was his environment. So if you remember the pain image that I said, that most times it is both the tissue and then the environment. So you need to have this holistic approach. If you don't deal with that, that young man would have kept on taking baclofen, even gone on to have surgery, and his pain will have still been there anytime he sees the woman. So a lot of times we need to have that. And like I mentioned, some gentle exercises, just some gentle movement could have helped to reset. So if you've learned nothing at all right now, I want you to know that anytime you're having issues of back problem, it's not just a single problem. We need to peel back and find out what time, when did it start, how often you have had, what are some of the things that you do that makes the pain worse, what are some of the things that makes the pain better. Can you specify? Because one thing about back issue is that over time, a pain that can be localized just around here start to spread. Something we call peripheralization. The pain start to spread all over. So you ask the person,
Where's
where do you
211?
and then they'll tell you all over. But so most times when people start to have the back issue, they want to blame maybe the last hotel bed they laid on. Sometimes it's not just that. Your cup has been filling up. There were so many things that have been filled, and so that hotel bed was the last straw that made everything boil over. And until we go back to take these things step by step, it's going to take a lot of time. It's like if you don't deal with that and you blame the hotel bed, you change the bed to another bed and you realize that the pain is still there. And like I said, it's just like the last maybe kinky you bought. You are blaming the last kinky you bought for the reason why you are being broke. No, the fact that you broke was not because the last kinky or the last sardine you took. It was decisions and other things that have been building up all this while. Probably the last kinky, the last sardine, the last coffee was just the last straw that brought out the problem. So most times what we need to look at is that if you have a back problem, we need to do what we call, what does my health ecosystem look like? Maybe that one will give us more clues as to why you are having the pain. And by health ecosystem, I mean this. Your sleep quality. Have you had new experiences? Family dynamics, your diet, your happiness. Are you engaged in sport, exercise, hygiene, your lifestyle, work, friends, meaningful activity? All these things, this whole ecosystem can have you have serious back issues, and it has nothing to do with structure. So if you feel lost with your chronic back pain, ask yourself, what can I do to become healthier? Because if you can take decisions that will help you become healthier, trust me, in my 17 years of experience, people who have made healthy decisions have had their back issues resolve or decrease significantly. Because some people have persistent back pain beliefs, ones that keep them stuck and the ones that help people to recover. For instance, there are people who think that their back is out of whack, it will never get better. And there are those, and I want you to be part of those who think that there are things I can do to improve my back. Some people think, oh, I need to get more core strength. But I want you to understand that moving is safe, even if it hurts a little. Because now, because of what happened the last time, every little movement you make now, your body is thinking that that is trauma. So it will prevent you from the part of your brain called the amygdala that heightens fear has been heightened. So now, because of what happened yesterday, every movement is seen as a threat. We need to start introducing certain movement gradually so that your body can tolerate it. Most people have been made to believe that their back is out, is gone. I want you to believe that your back is strong and stable. Yes, it hurts, but it doesn't mean it's broken. We just need, some people think, oh, I've been told I have a slip disc. In fact, I know some people will ask the question, and we will talk about that because I want to bring this to end so that I leave the rest of the minute for questions so that all the other things I can bring up. Some people think that, oh, I need to be careful with my back. I want you to know that, yes, you have to start moving slowly to build yourself back up. It doesn't mean that you have to completely avoid movement at your back. Some people think that I've got bad back genetics. Now we know through epigenetics that we can change our entire health ecosystem by making healthy choices. So yes, I can retrain my pain system like I talked about, so that the overly sensitive alarm system, I can bring it down. just by little changes that we can make. So the question is, you decide. I think I want to end it here. There are more things that we can talk about, but I know that there are questions that people want to ask. So I'll leave it here so that the questions will come, and then I'll bring the answers on the other side of the slides that we have available.
Oh, thank you so much. Thank you so much, Dr. Ben. Thank you so much. And we've opened the floor for questions. I think the more questions we have, the more we can learn. Yeah. Let me see.
Okay. So I think whilst you're waiting for the questions, so I'll just keep on. So if anybody could have a question, I will just stop. So, okay.
Yeah. If you okay, Mama Nkechi. So when you accident, bear 3-4 times. Not all the whole body icky, like you back, you baby, and it's an idea.
Okay. So my mom here is asking whether you had like multiple accidents and then your back and your whole body is aching. What can you do? Well, one of the things that you can do, you remember I mentioned the alarm system. Because you had multiple accidents and all of that, all that trauma has been sent into the brain. And then your brain is on fire. And that is why you are having all that pain. So one of the things, and you ask the question at the right time, I'm going to go through these 5 steps that you can use to help out. One of them, you need to choose an activity you enjoyed. Yes, in the acute stage, you are taking Tylenol and other things to reduce the intensity of the pain. But that alone will not solve the problem, because anytime you've had a health issue, your capacity for activity reduces. Because when the initial pain happens, you are no more lifting, you are no more walking. Some of the things that you used to do that makes your system strong, you are no more doing again. So when the pain decreases a little bit, your capacity have what? Decreased significantly. So find an activity that you love to do and ask yourself, what am I doing less frequently because of my pain? And then I may say, because of my pain, and then what are the activities? And that is the first question you need to ask yourself. And then find a starting point and set boundaries. So ideally, the amount of activity you can tolerate without pain getting bearable, start with that. So if you had the pain initially, and now because of the pain, if you walk, let's say 10 steps, the pain becomes unbearable. I will tell you to start walking 2 steps, because it is consistency over intensity. Trust me, because now you walk 10 steps and you hurt. If you start walking 2 steps and you realize you don't, do the 2 steps consistently for a week. The following week, add 1 more step to it. One of the things you are going to notice is that your activity and your capacity for activity tolerance that had decreased, you realize that it starts to what? Increase gradually. So have that starting point. Set boundaries. Decide on the amount of pain you can tolerate. So don't go like today, Dr. Ben talked about, and tomorrow I'm hitting it, I'm going all the way out. Please. If your pain level, you can actually tolerate up to 2 or 3 out of 10, go there. Any activity that is within that range, start with that. And do that consistently. If you do that consistently, like I said, and you add just 1 more level to it, your body is not going to push back. Okay? The next thing you need to do, set realistic expectations for progress. It took a while for you to get to where you are right now. So you can't rush things, like I mentioned. So 1 minute, maybe a walk. Okay, because of the pain. Now, when I'm the one and once a while a couch potato now, because of the pain, you are no more moving, you are no more doing anything. Start with this. In your house, decide that every day, the living room, you are just going to go one round within the day, just within the house. Take a walk. Just that. Do that 3 times in a day. By doing that in a week, just see how your walking tolerance is. You are trying to bend. So when you bend a little, it hurts. Okay. So now I'm here. Okay. Every day, bend like this, just 5 degrees. Do the 5 degrees bending consistently. Because you did 5 degrees, now your body can now tolerate 5 degrees of bending. Tomorrow, add 2 degrees to it and make it 7. What is happening is that our body consistently change based on what you put in. And I give this example. For us, the men, when you shave, okay, the next day, do you see any hair? No. But in 3 days' time, what do you see? You start seeing hair coming and you ask yourself, I just did this shave in 2-3 days. Where from this hair again? Our body is consistently changing based on what you put in. So if you have initial problem and you cannot bend and you stop the bending, for the rest of your life, you can never bend again. No amount of surgery, no amount of drugs and everything will help you because your structure is going to grow. Because today, let's say you're 50. In the next 2 years, you'll be 52. So that structure that was 50 like this, in the next 52 years, are you now going to bend it after what? 2 years of not bending? It's never going to happen. And with that, it means that the pain is going to what? Increase anytime you try to what?
So
if you want to change that, it means that if I bend 5 degrees today, and I do that consistently, and tomorrow or maybe the next month, I add another 2 degrees, the math people here, multiply by 365. What will it be? Compare that with 0 degrees times 365 is what? It's 0. But 2 degrees multiplied by 365 days. Imagine what you have achieved. The finance people talk about the power of compound effect. In health, too, we have the power of compound effect. You do the right thing consistently over time, and you look back and realize, now I can bend. Even if I cannot let my hand touch the floor because I've been bending gradually over a period of time, in the next 5 years, the goal, the mountain top that you wanted to achieve, you are now able to achieve it, or you are close to doing it, compared to somebody who did nothing. So those are the 5-step approach. And then don't expect rainbows and butterflies. You will make mistakes. There are days that you're going to feel a little bit of pain. You feel a little, there's no problem. Back out of it. Give yourself some grace and don't give up. Come back to where you stop and continue. I always say that our health trajectory is not a straight line. It's always like undulating. Anytime your life is a straight line in the hospital, you know you are dead. Right? But the life you're going to have is just going to be, you're going to have good days and bad days. That should not stop you. I give myself an example. Last year, I have a group of friends, some of them in the UK, here, Ghana. And then the men, they decided that we're going to have a men's challenge. 100 push-ups a day. We are like, that is very ambitious. But we said that the 100 push-ups, spread it in the course of the day. Okay? Spread it in the course of the day. Do you know that when I started, I could barely do 5? Consistency, and that is why I talk about this so passionately. Consistently. Those of us who were consistent with it and we decided to do it for 30 days. Guess what? Today I can do 70 push-ups straight up. Recently, I went to Ghana and my eldest son was like, "Oh, Dad, I've seen you do push-up. I'm going to challenge you." That young man thought that he was younger, so he could challenge me. Yeah, he's 16 years old. I hit 70, and at 20, he was out. And his sisters and they were making fun of him. But this was me a year ago, could barely do 5. Today, I can do 70, sometimes 80 push-ups non-stop. The power of consistently done over time. I don't know if there's any question again.
I think,
yeah, Doctor. Okay.
Go ahead.
Yo, Doctor, Nyamisha Papa Pampachopi, as my kind make it to a be. You said me come with Jumano. Name me, she said, you're walking, no papa. No, you not me go to you. Let me go to me twice.
We will translate after she's done. Yeah.
Okay, about 5 years. Let me go to. And I may decide to say no. I didn't mean to go to. Let's try. Beginning of time, you boy reform. Kakrank, and then meet me go to pa best a bear at least bear 2-3 minutes. Cry me to my abende. Ain't no question me. I didn't wait and kakraka a boy papa. I mean, try that. See,
Amen. Thank you. So I think.
Can you translate?
Okay, so what she was saying was that while she was in Europe, she was having so much difficulty trying to bend. And then she decided to make a concerted effort, like I was talking about, and bending gradually. Now, currently, she's able to bend and hold it for about 2 to 3 minutes. But previously, she could barely bend. So most times, like she said, I've had people that, oh, my doctor said that because of my knees, I should never squat. Then I've asked the same patient that, okay, they said you should never squat, but you sit. And they're like, yeah, I sit all the time. And then I go like, okay, tell me what is the difference between this and that?
The chair.
Can somebody tell me? The only difference is what?
Chair.
Is the chair. Okay, so don't call it squatting. Call it butt to chair touch. So you're going to stand by your chair and then make sure your butt touches the chair and come up. Your butt touches the chair and come up. Your butt touches the chair and come up. And do that 10 times. Start with 10. You're going to feel your quads build up. Do that, and I'm going to challenge everybody here. Do that for the next 1 week and tell me how your quads and your knee feels. Do that in the morning. At work, when you sit behind and you're working, okay, find a chair. I'm going to do butt touches. Do that. 10 of those. Every 3 to 4 hours, do 10 of those. And imagine in the course of the day, how many squat or butt to chair touches you've done.
Butt to chair.
So most time I'm like, you don't have to spend time that I need to go to the gym or no. I work out, but I'll be honest with you. I don't remember the last time I went to the gym. But for those people who know me, I work out. I'm the person who will do my devotion in the morning, start with my devotion, do 70 push-ups, go brush my teeth, come and do another. And then when I hit the bathroom, when I'm going to take a shower, I do 50 squats in the bathtub before I get out of the shower. I found another way of trying to do all of that whilst getting ready to rush out of and go to work. So those are some of the things that we are talking about. Consistency. Done over time builds a lot of tolerance. Maybe Auntie be one of those, maybe we'll find another time. And we're going to talk about the x-rays and MRIs. In fact, for the sake of time, probably somebody else have, but I'm going to give statistics, research data on some of these things. So maybe as we take the next question, I'm just going to show a little bit of that. As we go.
Yes, and so we need we are pana a bone to bone. To me, wow.
Recording stopped.
Now we'll share here. Why yes, because I tried before and it gets worse because a wall with pain, a bone to bone. My surgery back with the other knee, it's very bad. If it is burned.
Okay.
After me cockrana, so a do baby one side the moi, that would to ashe.
Okay.
It is bone to bone, you know. A bed then I met me at that exercise.
Okay. Ma, thank you so much. One of the things you notice is that once you get to the level where you are getting the bone to bone now, it means the deterioration have gotten to a point whereby it's difficult for you to redeem anything. And that is why the knee gave up, right? For every knee, there are cartilages at the end of it. The cartilages serves as cushions. But remember, your kneecap have your quads attached to it. So anytime you move, like you mentioned, you've done the surgery on the other one, but if you don't build up strength on the other one, even after the surgery, you realize that you're having problems. That's why they are giving out. Because they did the surgery and then they replaced the cartilages at the edge. But the surrounding tissues, the muscles that should be strong enough to carry your weight, you've done nothing to help it. So it means that the other knee have to also be replaced. But whilst you get time or you make the concerted effort to have that other knee replaced, one of the things is that you can actually do non-weight bearing, because I don't know your weight. The reason why it makes that cracking noise and it's like giving out is because the muscle cannot sustain the weight that you put on it. So you can sit and maybe along the line, I can talk to her offline. And then we do what we call quad sets. We can do long ad quads, like seated exercises, which actually builds up the leg without you actually putting weight on it. So most times, if you talk to wherever the surgeon is, there are so many exercises that you can do without necessarily doing the squat because now the squat is moving your upper body on top of a stable leg. We can also move the legs on top of what? A stable upper body, just to take the pressure off the knee, whilst you get the mobility and you have the other ones replaced.
Rebecca, I think you can call Dr. Ben, is very helpful. So you can call and then you can do one-to-one consulting. Yeah, Auntie Rebecca.
Okay, thank you.
Yeah, thank you all so much. I think I feel guilty and for not exercising, and I'm sure a lot of you feel guilty too, because yeah. Or question? Do you have a question?
Media first more craving and me money in shares maybe a bit me a boy, you know.
Yeah, your time now, so you're about 8:06. I'm sorry.
Okay, no problem.
Yeah, 6 minutes over the time. Yeah. So I'd like to thank you all.
Auntie,
yes.
Miss Roman, the flower, I come baby, Miss Row. If you grab me microphone, be and to my name is Miss Rowa. Pacho, my name is Miss Row.
Okay. Okay. Let's go ahead. Can you ask the question and then that will be the last contribution of questions. So go ahead.
Okay.
Yeah,
okay.
You can say it in Pierre will translate because we have other
people. No problem. Okay, you friends, you are crying, can say, you the Dr. Bear for programming with your mind. You say what this on course on salmon in Indiana and Tom Costa, and I say, on your big platform, because in engine edition. Me go straight to the point, no. You friends saying, bear me what problem was, back pain. Na minya sa problem no ewo Europe because time box be Saturn 50 kilos. Na ma nyine ye na me fire. Ti mani ba me hoso na say but anyema like anyema ankoye. Enti no matritia but aha me ache. Enti no me ba nyina no ha me sa anti every year bia me hospital man hospital no me back pain ha me and I say e kan ho a me ko bia 3 times or 4 times a year.
Yeah.
But me na me call so another doctor say no I chronic enti no amame ibuprofen any first muscle relax na what amame na afi was me fan so no enti maya na bibi ka ba me say no I was say me de me ho hye gym mu am say me gym a ebeboa me enti me start say me ye gym me kwa na me de me na no me nana kasa pressure wo say wo do na pia bear about 120 kilos. Me pia. Na say, wow, show a hard in your boot to me. Na say, who pia sa. Me de me sapeja over 100 pounds. Who's my ya? I feel that within short time, me can say, bear I first media no a coming because some man could na. I say, me lusu a bibi wo nipeduenu. It in the comment say you who say me answer me kwa man me could na sana at least twice or 3 times a year there. Sorry, 3 times a week there. Me call, yeah. And you know me yes no.
Okay, our brother is testifying, Uncle Lauren. Sorry to cut you. Our brother is testifying how going to the gym helped with his back pain, and I think that's what Dr. Ben has been emphasizing on exercising and taking care of our back because we need our back for our lifetime.
Yep.
And on this note, I would like to thank you all for joining this program, taking your time off. I think it's a blessing that you all showed up. I'm so proud of all of you and supporting my organization when we invite you to our programs. I also ask you to go to our website. It's